introduction. I get the privilege of chairing this commission this year, which I think is my third time chairing. We rotate every year, once with the executive branch, legislative branch, and I believe Senator Donato will be next year's chair, and we are looking forward to that. We have a quorum. A couple things I want to say. On October 21st, we're having a 3-branch mental health summit in Indiana. I just got done touring the state. I have one more to do along with the other justices in the court. And we talked to all our judges. We've met with hundreds of judges in the last 2 weeks. And if I had to say, then we have a pass the mic, what's going on in your community, tell us, guess what their number one thing was? Mental health. As you know, the justice system is the number one referral source other than self to get people to mental health treatment. The judges are saying the cases are up 300% with regard to involuntary commitment, wait times on competency hearing. What do you do with juveniles? So the mental health needs have been very struggling. And what they'll say is that there's not a docket. It could be you've got a collection, a guardianship, an eviction, even a business case. Mental health permeates almost every case that comes before us. So both Justice Goff and the court, myself, are chairing a national committee on mental health. And we have worked with the governor's office. Doug Hunsinger has been phenomenal. Jay Chaudhry from DMHA, Senator Sandlin, Senator Kreider. We've had just wonderful support. 3 years ago, we sent a team, including these individuals, to Deadwood. They call themselves Deadwood, Minnesota. Where's Deadwood?
South Dakota.
South Dakota. I said, stop calling yourselves the Deadwood team. You need something catchier. But they have been meeting. So we're really excited at having this. We're going to have teams, the JRAC teams from all 92 counties will be there. We did this with substance use. I think we have the unique opportunity in Indiana to lay a foundation now for 5 to 10 years, things looking different. We're going to correspond the mental health needs. We're going to look at that as we did substance use. We're training our judges. We're looking at diversions, the sequential intercept model, mapping mental health services. But I think the opportunity we have to make real change that our mental health delivery system in 5 to 10 years can look different. And I know there's a lot of entities working. We're looking at with regard to having the 3 branches. What is it the 3 branches can do? 988 rolling out, just looking at a simple surcharge on, like we did for 911, could bring in the amount of money that we have for crisis mental health services, because the issue is people need to know who they call, what's going to happen, and where they're going to go. So this, everybody around this table, because you're all here because you deal with something on children. It's going to be something. So you will be invited. We'll get the brochure again. We're going to be at the we're at the convention center for this, Justin, correct? We're going to be at the convention center. We're going to have probably over 1,000 people. We'll have groups of teams from each. There's going to be breakout groups, and it's really going to be with your local Justice Reinvestment Advisory Council. We want the mental health providers at the table. We want the sheriffs. We want the public defenders, probation, prosecutors. So we're really looking forward to this as far as launching things. We are getting definite ideas nationally of what's working in other communities. We've sent teams to review what's working in other communities. So just put that on your calendar, October 21st. And I know Jay will be doing a presentation on mental health at the June Children's Commission meeting. Is that correct, Jay? So that was just my comment there. So welcome. Thank you all for coming. This is when we've been Zoom. I will tell you, having been involved with the Children's Commission since its inception, I know you all have full-time jobs that have probably plus. The attendance rates for these have been phenomenal. So thank you for coming and showing that working together with regard to the welfare of vulnerable children is so important. So we have a consent agenda. We have the minutes from the December meeting. We have the request for the appointment of a new co-chair for the child health and safety. And can you give us the background on who that would be, Julie?
Yes, and I apologize for the error on the agenda. It's actually the February meeting minutes. The co-chair nomination is Sonia Rush, actually no relation, as far as I know. And she is a DCS senior team member in the Agency, oh, you're gonna have to help me, Terry. What's agency transformation?
Strategic Solutions and Agency Transformation.
Yeah, and she's been a little, not deeply involved with the commission up to now, but she did work on the planning committee for the Family and Youth Summit last fall and was really instrumental in getting our DCS bio parents who spoke at that summit and were really well received. So she has agreed to serve if appointed.
And just to remind the commission, we sort of part of our strategic plan, we rotate, so you don't feel like you have a lifetime, like a Supreme Court, US Supreme Court appointment, a lifetime appointment, if you volunteer to be and chair one of the committees. And I think it's been very effective by bringing new people in, sort of building the bench in the future with regard to people that are working on child welfare. So thank you, Terry, for that appointment. And I will never remember what her job is. So is there a motion to approve the minutes and the appointment of the new co-chair? Is there a second?
Second.
And if there's no further discussion, all those in favor say aye. All right. Next, we'll talk about the strategic priority of juvenile justice and cross-system youth, and Megan Horton and Tracy Fitz. We'll be talking about the current state of juvenile diversion in Indiana.
Thank you, Your Honor. Good morning, everyone. It's a pleasure to be here this morning to talk to the commission about what we've learned about the practices around juvenile diversion in Indiana. For those of you that don't know me, my name is Tracy Fitz. I'm the juvenile delinquency prosecutor for the Indiana Prosecuting Attorneys Council, and I'm presenting today with my co-chair, Megan Horton. Megan's the JDAI Juvenile Justice Strategist with the Office of Court Services. You're going to be hearing a lot from her in just a minute about what we learned from our surveys. But first, I wanted to just give you a little bit of background on our subcommittee. So we are under the Commission's Juvenile Justice and Cross-System Youth Task Force. We are a newly created subcommittee. Newly created, it's been 2 years, but it seems new since we had a little maneuvering to get around a pandemic and some other things. But we were created with Objective 4 to identify and encourage adoption of effective and promising practices for preventing and diverting youth from entering the juvenile justice system. And people may ask why this focus on diversion, why were we created? I think this quote from the Annie Casey Foundation says it all. Where you can
We
say-
don't have these slides.
that.
do
You
we?
don't have this?
No.
I think we have a different packet from another month.
Oh, no.
October of 19. It says 19 on it.
I'm happy to read it if that helps.
I'm so sorry. Yeah, if you have a device in front of you, everything is on the website. It's at in.gov/children. You can, of course, look at the screen. I'm so sorry. I don't know how that happened.
And I'm sorry about that. Also, I can go ahead and read it. So the quote from the Annie Casey Foundation states that the available evidence indicates that arresting young people and formally processing their cases in court significantly increases their likelihood of subsequent arrests. Arrest and formal court processing also reduces young people's odds of future success in school and employment. So the point being, if we can safely divert kids from the system, we often get better outcomes. So once we were formed, our group decided to identify decision points at which youth can be diverted safely from the system and identify best practices and model programs. But before we could do that, we needed to know what the current state of diversion was in Indiana. And it might be a surprise for those of you that don't work in the justice system to realize that there's actually no mention of diversion in the juvenile code. The statutory options, actually, when we get a referral, is to file a petition, informally adjust the case, refer the child to another agency, or dismiss the case. So informal adjustment is really what we're talking about in the code when we're talking about any type of diversion. And it's true, there's no formal petition filed, there's no adjudication entered, but there is an informal adjustment agreement, and that often gets filed with the court, and there is a paper trail there. Informal adjustments are not to exceed 6 months, but they can be extended for an additional 3 months currently, as well as fees are able to be ordered. I would just note, since this all started, House Bill 1359 passed this year. It changed what informal adjustments are going to look like a little bit. They no longer can exceed 6 months. There's not going to be any extension of 3 months, and you can no longer order fees with those. So fees are no longer going to be associated with having the chance to have an informal adjustment. But we knew, those of us on our subcommittee, that there are a continuum of ways that kids can be diverted. And if you think of the juvenile justice system as a highway, and it starts with that alleged delinquent behavior all the way to a disposition, we knew across Indiana that there are lots of off ramps, but we weren't sure how they were being used. It could be as simple as law enforcement doing a warn and release or meeting with the family. It could be diversion at intake, where probation sends you to a community program or gives your family resources. It could be that informal adjustment that we talked about. And it can even happen after a formal petition's been filed. If the judge, since the judges control informal adjustment, wants to send a case back for an informal adjustment, or they want to, there's some agreement to withhold prosecution, there can still be some type of off-ramp even after a formal petition is filed. So as first steps, we knew about informal adjustment. We knew there were lots of other practices, but we really needed to learn how the system was working across the state before we could make any kind of recommendations. So we started with really informal information gathering surveys that were sent out to prosecutors and probation, and then a separate survey that was sent to judicial officers working in the juvenile area to get a snapshot or a better understanding of all the ways that we were diverting kids from the system. And I'm going to turn it over to Megan now. She's going to tell you what we learned from those surveys.
Thank you, Tracy. Good morning, everyone. As Tracy mentioned, my name is Megan Horton. I'm a youth justice strategist with the JDI state team at the Indiana Office of Court Services. So Tracy just provided a really great outline for you of the foundation that our subcommittee had when we started doing this work. As she mentioned, we were tasked with identifying best practices or promising programs in diversion around the state. But before we could really start digging into that, we realized we needed to know what was happening in the counties, because there hasn't been that common language, those common definitions or parameters. It was really important for us to understand the landscape as it's actually happening in the counties. So as she mentioned, what we're sharing with you today is the information we gathered from those surveys that we sent out to the counties. We've called this our snapshot of diversionary practices around the state. And we really just scratched the surface with this. This was a first attempt at gathering some of this basic information from all the counties. And we think it's a great starting point with several areas that our subcommittee has identified for additional focus. As Tracy mentioned, we started this work prior to HEA 1359 being introduced, but we think what we learned could be a really useful foundation, and we're hopeful that it will dovetail nicely with the work to be done from that bill. So I realize you don't have these slides in front of you. I'm going to do my best to describe. And as Tracy mentioned, we sent these to 3 different stakeholder groups: probation, prosecutors, and judicial officers. We're going to start with some maps that'll give you a sense of what these diversionary practices look like from a state perspective. I want to preface this with a little bit of a description around how we approached these surveys. We wanted to cast a really wide net because informal adjustments are the only statutory diversionary option, and we don't have those common definitions around the state for diversion. We really wanted to ask broad questions to the counties. We wanted them to feel encouraged to share all of their programs, practices, policies that they've implemented. So that illustration that Tracy showed around that roadmap, that continuum, we wanted them to share with us all those off-ramps at whatever decision point they may have employed them. Also, in the interest of maximizing responses, we didn't require responses for a lot of these questions. So there are still some areas where we're missing some data. The probation officers and prosecutors received an identical survey. The survey that went to the judicial officers was slightly different. It had slightly fewer questions, and it had more free type style responses. So this map is showing us that the vast majority of counties, 85, the counties in blue, had at least one stakeholder group respond to the survey. The highest turnout was from probation officers. 68 counties, in 68 counties, at least one probation officer responded. In 58 counties, at least one judicial officer responded. And in 32 counties, at least one prosecutor responded to the survey. In total, we received 175 individual responses to the surveys. Only 7 counties provided no response. So of the 85 counties that responded to the survey, The map on the left shows us that nearly all of them, the 84 counties in blue, indicated they do have some form of diversionary practice program policy in place. Only one county, the county in orange, indicated that they do not. For some context, I'm using the phrasing program practice policy intentionally because there are so many different ways that youth might be diverted from the system because of all those different decision points at which those off-ramps might be implemented. We really wanted to make sure that counties were encouraged to provide all of those different pieces of information. So even if something is less formal and may not look like a program in a traditional sense, we still wanted to hear about it. So the map on the right drills this down a little bit further in terms of those informal adjustments that Tracy described. Nearly all of the counties, 78 counties in blue, indicated that they do use informal adjustments, which we anticipated since that is provided for in statute. For the 5 counties in yellow, the responses were unclear as to whether or not they used informal adjustments, and the 2 counties in orange specifically stated they did not. So our subcommittee agreed that this was an area for additional follow-up. Are informal adjustments not being used in these counties? Would this answer look different depending on who responded to the survey? Or perhaps it was in the way the questions were worded. So looking outside of informal adjustments, we wanted to get a sense of who is doing something else, who's doing something else or in addition to those statutory informal adjustment processes. So peeling this back another layer, the 68 counties in blue listed at least one diversionary program, practice, or policy other than or in addition to informal adjustments. The 17 counties in orange didn't provide information for any program, policy, or practice other than informal adjustments. And please, if anyone has questions, stop me along the way. Feel free to ask any questions about the data that I'm sharing. So our final map takes this a step further to illustrate how many programs, practices, or policies counties have in their diversionary continuums. So how many of those off-ramps have they implemented? We formatted this as a heat map. So the counties with the more darkly saturated colors have more programs and the lighter ones fewer. We capped these categories at 4+. However, we had a handful of counties that reported upwards of 7, 8, 9 programs. So there's a lot more information to be learned here from some of these counties with seemingly very robust diversionary continuums. So now that we've taken a look at this statewide perspective on these maps, we're going to zoom in a little bit from that county perspective and look at some program related information. There's a lot on this slide. So I'll try to just give a synopsis of it. In total, we received information on 228 programs, practices, or policies. And the remaining data slides we're going to look at are going to focus on those programs. And again, what counties provided as their diversionary practices and programs was at the discretion of the counties. We didn't give parameters. We didn't make decisions as to what we thought qualified as a program or practice. So there's still a lot more to learn about what these look like in practice in the county. So in this chart, we attempted to categorize these programs, practices, and policies into light groupings based on the information that was provided. As previously discussed, informal adjustments is that largest bar. They were the most prevalent, but also with some strong utilization across the state. School and truancy focused programs, warn and release policies, or other types of informal meetings or letters to a family without further action by the system, and referrals to other agencies, and also teen courts. There were 12 teen courts across the responses we received. We also thought a couple other notable types of programs, but less frequently used, restorative justice and mediation, mentoring, education and skill building classes. So there's a range of diverse types of programming that's happening to some extent across the state. So, and I won't read you everything on this slide, but we wanted to provide you with a look at some of those programs that weren't categorized on the previous slide. Each of these programs or practices was only listed by one county, and we just simply didn't have enough additional information to be able to discern what type of program it was or how it would be categorized in those other groupings. Another area that our subcommittee identified for follow-up. So probation officers and prosecutors were asked which stakeholder groups implements or administers each of the programs. They could select multiple groups if that was applicable. Probation was the most frequent response. This was followed by prosecutor and court. However, there were still many programs for whom schools, other community organizations, or law enforcement were at least in part involved in administering the program. Our subcommittee was really interested in these community partnerships that local sites have developed to develop these programs. And so where they mentioned other community organization as one of the stakeholder groups that was involved, we asked for some additional information. And that's what's on this slide. Again, I won't read through everything, but our subcommittee felt that learning more about these community partnerships could provide a really rich resource for counties, especially as they're trying to bolster their current diversionary options. Oops. So the previous slide was looking at who implements or administers the programs, but we also wanted to learn about how the programs were developed and by whom. So this yellow bar chart, we asked counties which groups were involved in putting together the programs and developing these programs. And this chart shows us that it was largely collaborative. Most of the programs were developed by some combination of at least two or more of those previously described stakeholder groups. The most common collaboration is between probation, prosecutor, and the court, which makes sense given what they indicated on the previous slide. But there were 22 programs that counties indicated were developed by only one stakeholder group. So we dug into that a little further in that green bar chart. And probation, again, was the most frequently named stakeholder group, followed by those other community organizations. So taken together, our subcommittee thought that these responses do seem to indicate that counties are working collaboratively to develop these programs locally, and it's still largely driven by justice system stakeholders.
Maggie, can I ask you a quick question?
Yes, absolutely.
Looking at slide 15 and thinking about Tracy's initial presentation, that in the statute, there's no formal like word diversion, right? It's informal adjustment. So looking at this slide, there's a recognition that informal adjustments, are the most, but then diversion is on here. Can you tell us, when you say diversion there, is that a pre-court activity, maybe by a community entity working in collaboration where, like, is it law enforcement, or what does that mean?
In the slide that's categorizing the responses, the
Correct.
programs, that's a great question. And I think that's something we would want to know as well, because that is something that county just reported as diversion. And so I think that's a great question. Knowing that that isn't one of those specific statutory options, we'd want to learn more about that.
Is informal adjustment is in the statute. It is by survey the only way that we can ascertain who's using informal adjustments county by county. I guess I'm a little surprised about that, but maybe I shouldn't be.
Yeah, I wonder why you can't pull from Quest, like for the Quest counties, which have about 65% of the juvenile caseload, and then Odyssey has the rest. And if we can't do it, it's something we could probably program and do. Did you ask anybody? Justin, do you know? If it-
As long as it's a case, I mean, I don't know if it's.
As long as they assign a number.
Then it wouldn't be in Quest.
In IA, they have to sign a number, don't they? If it's an informal adjustment. What about, Corey, what about
Can you
diversion?
guys use microphones, please?
Yes, IAs are filed with the court, so they would pull a case
What
number.
about
and-
diversions? They don't get a number, do they?
No, but I suspect you could pull that from the preliminary inquiry. When we prepare
Right.
the preliminary inquiry, there are drop downs that does pull certain data from probation's recommendation at intake. And then I think there's a second prompt that asks a second question. I don't specifically remember. And then the PDR for more formal cases.
Did you check with Court Tech about?
We haven't. I think that would be a great next step to figure out the more specifics around the data. I know one of our next steps that Tracy's going to discuss is around specifically informal adjustments, because we knew that was going to be a really commonly used practice, but we were also trying to gauge all those other pieces. So yes, I think that would be great information to have. And I think it might look different, again, county to county, depending on how they're entering that data. But yes, I think that would be a great next step for us when it comes to data. Any other questions? So we also wanted to find out what might be missing. from local jurisdiction. So probation and prosecutors were asked if they believe there were cases that are not being diverted that could be. Most said no, many were unsure, and some said yes. Again, being our first attempt at gathering this information from counties, many of these responses raised more questions for us than they answered. And this is certainly one of those areas. For instance, the counties that said no, do they feel they already have sufficient diversionary programming? Do they not see the value in diversion? Or do they feel they don't have adequate program services or community supports to be able to divert more youth? And for those who answered unsure, what's driving that response? It'd be really great to learn a little bit more about that as well. So this is one of those areas that certainly warrants some further discussion. For those 14 yes responses, we asked for some follow-up about what are those cases? What are those types of referrals that counties believe they might be missing, that could be diverted, that are not currently being diverted? The probation and probation officers and prosecutors, the top bar tells us that their top 3 most frequently mentioned referral types, low-level and first-time misdemeanors, status offenses, and mental health related referrals. We also asked this question to the judicial officers. And for all of these, the responses could list as many things, as many reasons that they felt were appropriate. And in the judicial officer survey, it seems significant to note that the top 2 responses they provided align with the responses for probation and prosecutors, low-level offenses and misdemeanors, and status offenses. And the judicial officers also mentioned mental health related referrals, school situations, and domestic violence issues. So the last of our data is looking at some practice-specific questions of the prosecutors and probation officers. So for each program, we asked, are there documented policies and/or admission criteria for each of these programs? Is data being collected? And do they believe the program to be effective? Again, these responses, the answers to these responses weren't required, so we still have some non-answers. But from the responses we did receive, 89 of the programs have documented policies and/or admission criteria, 44 do not, and for 10, there were conflicting responses. So that means that multiple stakeholders from the same county answered the question about the program, but they have different answers. So the blue chart shows us that of the responses we have, data is being collected for only 55 of the programs. It's not being collected for 82 of the programs. And again, there were 9 conflicting responses. Finally, the green bar chart shows their responses to a question about whether they believe the program to be effective. 68 described their program as effective, 27 extremely effective, and 38 felt the effectiveness was mixed. They weren't able to say one way or the other. So again, so much more to learn from all this. If we don't have data, how are we gauging effectiveness? These are some questions our subcommittee had. For counties that do have policies and data, what does that look like? What data is being collected? Who's collecting it? How is it being used? Another piece of information that would be great to explore are counties gathering information and learning from the youth and families that are receiving the services and programs and consuming those programs that they're providing. So I feel like a theme for our survey process was we've learned a lot, and we also have a lot more to learn from this. So if there are no questions about the data or the maps, I'm going to hand it back to Tracy, and she's going to recap some of those areas that our subcommittee identified for next steps and our recommendations for moving forward. Yes.
I wanted to say that that's a very interesting presentation that you made, and the data is very interesting. But do you, when we talk about informal adjustment, is that a specific, are there specific things that are associated with being called an informal adjustment that are in the statute that have to be done, that have to be adhered to specifically?
There are those general guidelines in the statute. Oh, I apologize. There are those general guidelines that were discussed in the statute that Tracy mentioned, but this is actually a really good point because this is one of those areas of follow-up that we had as well. How are counties defining that locally? What are the criteria? What does it look like? Because I think that's another place where there is a wide difference from county to county about how they actually implement those informal adjustments in practice.
And did any of this data disaggregate the information by race or by type of infraction, whether it was mental health related, whether it was, the type of infraction that it fell under?
Not yet, but that was definitely one of the areas we talked about as well, especially knowing that it doesn't seem to be there's consistent data collecting practices amongst the counties. I think that was certainly a point that we also had. If we are tracking data, what does it look like? And for those that aren't, how are we gauging how these programs are being utilized? And also the documented policies and admissions criteria, that also seems a little inconsistent. So I think we also learned from these surveys that it would be nice to have more required responses in some of these places, because we also have 89, I believe, that didn't answer the question as to
Well,
whether they
and
have those
For me
criteria.
personally, I'd like to know how many of these diversionary programs, well, what does it mean to be a diversionary program? Sounds like the spectrum is wide as to the answer to that, but how many of these diversionary programs are putting kids of color in them, or kids of color being sent directly into the system and kids of not color are going into diversionary programs? I think we need to get a snapshot of what that looks like from across the state, because I have some instinctual feeling as to what that probably looks like, but it would be nice to get some data. And it looks like we're close to it, but we haven't, you didn't quite get there with this set of questions.
Yes, I would agree. I think that's exactly what we were hoping to be able to move towards. And I also think we're going to have, and as Tracy's going to mention some of those next steps, I think some of these things will come along with the work being done in 1359. But yes, I agree. We had those same thoughts that hopefully this is a good jumping off point, and now we're going to be able to follow it up and get some more specifics.
And my last question is, the definition of effective, when they define it as effective, what does that really mean? And are there some specific ways that we can nail down what an effectiveness program looks like?
Yes.
Senator Bro, if I could answer that, that's exactly what 1359 and what we're doing with regard to having a data committee. And one of the charges to this commission is exactly what you're saying. I'd like to see this data on this. Should it be justice by geography? If I live in Perry County and I get arrested and there's no diversions available, is that, you go right to detention. So we're looking at best practices. There are evidence-based programs that we know work. And we want to have a global view. We have so many thousands and thousands of our vulnerable children in these systems around the state. So this is going to be, we're going to talk, Julie's going to get right into this. We're going to talk about the oversight committee set up by legislation, and then all the different subgroups, making sure we've got the right players in all these subgroups so we can collect that data. And our charge as a commission to them is, I would like to see if there's disproportionate minority impact with this particular diversion program, and where are they? And there may well be a need for legislation with regard to legislatively saying diversion is an option. And we know that if we can divert low risk kids from the system, you take a low risk kid and you put him in the system, we make them worse. So great question. I know you're just at the top of the iceberg on this issue.
We were very pleased with all the information we had, but like we said, so many more questions just came from it. And it was
It's a good
also interesting.
starting point, though.
It was
Really
really
is.
interesting to see what we were able to get and what we weren't. So
Chief
lot more.
Justice, may I ask a quick question? To Tracy and Megan, as you all are digging to the next level on. Thank you, sorry. As you're digging in the next level on data, I would be really interested to know about school referrals. I've been increasingly concerned over a long time of behavior that when I was a child was just childish behavior, and there was a school resolution to it along with parents, and that was the end of it, becoming cases. And so I would like to know more details about school referrals. What is that process of resolving a matter in a school versus now we're going to make this a report to the criminal legal system regarding this child? So that's an area that I'd be interested in.
yeah, I would agree with you. I think understanding the referral sources of these and for counties that have admission criteria or policies around how we're using our diversionary programs, what does that look like from those different referral types? So
And I just found out, because we text each other, why are we not requiring this field be signed on our intake or diversions? And it's not required now, but based on this information, we can mandate, we can require that be a field. So it's interesting the things that come to light. I would have thought it was a required field.
Yes, and if I could expand on that.
Could you
the-
move it closer?
Sure. The required field, and we just communicated with Court Tech on this earlier this month for some local data, is the probation officer's recommendation, but not the outcome of that recommendation. So we may recommend diversion, but that may ultimately not be. So there's really two data points that are pretty important. So the first is required, the second is not.
Thank you. And based on that continuum that Tracy provided, at all those different decision points, what information is being collected may look very different depending on the county and the program and who's responsible for making that decision.
Oh,
Thank you, Your Honor. Thank you, Megan and Tracy. I think this is valuable information, a great first round. I think it's significant that we have 68 counties doing these diversion programs in addition to informal adjustment. So that was news to me. So that was
well,
very,
don't stop them.
that's very encouraging. And I think it gives us a good foundation to implement 1359 to kind of best practices, what these counties are doing to help make that more uniform. So I commend you for digging up this information. Thank you.
Thank you. Any other questions before I hand it back to Tracy? Thank you all very much.
Thank you. And I don't really have a lot to add, but as we discussed, it left us with just a lot of questions. Here's some areas that we wanted to follow up on. Terms, criteria, and process for informal adjustments, identifying barriers to diversion in certain counties. Is it just a question of you don't have enough cases to have that program? Can you do something regionally so you can provide it to more people? What data policies and criteria, what's effective programming, all of those things we've looked at. And we planned on follow-up surveys, maybe a data pool, or even site visits once we dig deeper. But the landscape changed a little bit. As everyone knows, we now have House Bill 1359, and it's creating that juvenile justice oversight body. And they are tasked themselves with a lot of work around diversion. They need to come up with policies and protocols for research-based pretrial diversion and informal adjustment programming and practices. They need to make sure the validated risk screening tool to inform diversion decisions is working well. And they also need to develop a plan for diversion grant programs. So there's a lot going on. We did not want to move forward in a way that wasn't going to be helpful to them. We didn't want to waste time with our committee because we've spent a lot of time doing this and we care about it. So we really put a pin in things and wanted to make sure that we were in sync with whatever was happening with that oversight body. So really our only recommendation today is to share this information with the oversight body, whether in person or just give them our information. And also to let them know that our prevention and diversion subcommittee is willing to work with them. In fact, we talked to everyone on our committee, and I'd like to thank them all. Here's a list of the people that are on this diversion subcommittee. And they are all willing to work with that juvenile justice oversight body in any way they would like us to move forward with their tasks.
Any other questions? Thank you. Wonderful presentation. And I'm sure that the answer to that last question is yes.
Great.
So that is a perfect segue. If I may, is it okay to continue, Chief?
Oh, sure, please. Jen.
And please accept my sincere apologies for having the wrong PowerPoint printed. The rest of the packet is correct. It's just I just sent the wrong PowerPoint to print. So that's entirely my fault and I apologize. The correct one is on the website. So if you have access, you can follow along on the website if you need something closer than the screen. Okay, 1359. So this is something you all have been hearing about for the last couple of years, right? As we've kind of worked with the Council of State Governments Justice Center, developed the recommendations, which were presented to all of you back in December, rolled into this bill, which has passed and now gives us a lot more work to do, which is great, actually, because it's exactly the kind of work that we should be doing. So 1359 tasks the Children's Commission with creating a juvenile oversight body, which you just heard referenced, with appointments made by the Chief Justice. And then it tasks that oversight body with these next like 5 or 6 projects: a statewide data plan, policies and procedures around risk and needs assessment, a statewide behavioral health plan for justice involved youth, policies and protocols on just what you just heard about, pretrial diversion and informal adjustment, and then a plan for grant programs to fund all of those things. And well, I'll get to the timeline in a minute. And then just to review just a couple of additional things that are in that bill. So then it also tasks the judicial conference with developing statewide juvenile probation standards. We have probation standards as a state, and there are some references to juvenile in there, but there's not a separate set of standards for juveniles. And so there will be now. And the interesting part about that is, so it's a project similar to those other projects, but it really falls under the judicial conference, which manages the current probation standards, but we'll be coordinating with them. And then they have to ensure that adequate training is provided to juvenile probation officers on both the probation standards and the risk screening tools. OJA, Justin Shop, shall administer the statewide data plan. So we'll have a data group kind of coming up with that plan that then ultimately will be kind of handed over to the Office of Judicial Administration to administer. And the Criminal Justice Institute will be administering the grant programs once those are developed. So that'll be after a year. And then there's a number of other things in the statute that I didn't detail here that local counties need to be doing right away, like not detaining children younger than 12 if they don't pose a risk, an immediate risk to the community, and using the risk screening tools that they already have and documenting reasons for detaining if the risk tool says the child is low risk. So as far as structuring this work, I've been having a lot of conversations with the Chief Justice and Justin and Mary Kay Hudson at the Office of Court Services to really think through what does this look like and how do we get it all done in the timeline that we have, because it's a lot and we want it to be done really well. So, so besides the juvenile oversight body, and let me actually go back for a second. So all those different projects, I'm calling them each a project, it says the oversight body shall do that, but there's no one group that can do those 6 things in a year. Right? So, so as we've discussed it, the CJ and I and others, we need to have work groups. And plus they all are slightly different topics and folks have different levels of expertise, right? So, so what I'm proposing is that we have this set of work groups that you see here. So one for data, and that is going to be largely composed of a subset or it will have a large amount of overlap with the current data sharing and mapping committee of the Children's Commission, which has also already done some work in gathering some juvenile justice data over the last couple of years, aggregate data. We'll add some additional folks, some local folks who can inform more about like, how do counties currently collect data? What are the barriers? What are the challenges? What would be useful to them? You know, one of the challenges I think sometimes we run into is we ask people for data and then they never see it again. They don't see how it's useful. And so we want to make sure that whatever we're collecting, we can kind of provide back to the counties so that it's useful for them in their ongoing decision-making. So we'll have a work group that's working on all those data questions. And actually the statute does a pretty good job of detailing. There's like 4 or 5 different things, elements that need to be included in that statewide data plan. So they'll look at that. We're proposing a work group on transitional services. That's another thing that needs to be looked at. And you heard at the last meeting from Joel Weineke, who is very, just like this diversion group, we already had a group looking at kind of reentry and transition back to home under our Juvenile Justice and Cross System Task Force. And so they did a very similar thing. They kind of took a snapshot of what's happening right now in terms of juvenile reentry, what kinds of services are available, how competent do people feel to be able to help juveniles in those areas. So we have, again, sort of that preliminary snapshot already. And that that subcommittee already kind of primed to keep going on that topic. And so then the next step over the next year would be to then develop some policies around that, look at if we were going to provide grant funding for those transitional services, what should that look like? What kinds of things should be funded? The next work group is pretrial diversion. I really hope that we take Megan and Tracy up on their offer and let them keep right on going on that topic. And again, develop, do those things that are in the statute, develop the policies, the definitions, the parameters around what that should look like and what should be funded in a future grant program. And then we have behavioral health, which obviously I've been talking to Jay about. So that's not something to do in isolation from DMHA. It will be led most likely by DMHA in conjunction with justice stakeholders, right? Really with that focus on youth. So what are the kinds of services that youth coming into the system need and can't get? How do we make sure they can get them? And again, if there's grant funding that's going to be allocated, what kinds of services and programs should be covered with that? There was also something very specific in the statute related to assessments. And I don't know if you all remember this from one of the many presentations we had, but one of the issues that came up during the CSG assessment was we are sending juveniles sometimes with pre-adjudication. So we don't even know if they're quote unquote guilty. I know it's different with juvenile. We're sending them to DOC just to get a mental health assessment. And we do that for good reasons because DOC does a really good job with those and they have quick turnaround, but we're sending those kids behind barbed wire in a correctional facility for a mental health assessment. So
Julie, if I could I was talking to judges this week, 12 and 13-year-olds, they cannot find a placement for that are going to DOC so they can get a mental health evaluation. And the judges said, you know how you go to Kings Island, there's a ride, you have to be this tall to get a ride. We feel like before we put a child in detention, they should be this tall. But it's tragic what's going on. And I heard it from judge after judge after judge. These are young, these are middle school, high elementary school kids that, anyway, I don't think anyone's from DOC here today. I think they're.
I'm not from DOC, but I've had a lot of friends and everything.
Dejana, can you speak into the microphone?
I said I'm not from DOC, but I've had a lot of friends end up in DOC. You are so right when you say that. It kind of starts a cycle too. It kind of starts, and then next thing you know, like they in and out of jail when they get older, you know, simply because that was stability. While they were at the age where they should have been learning communication skills and relationship building, they learn from their environments behind them.
Well, and I was at your kids program this week, and there was somebody who was in kindergarten, I believe, that was expelled from school.
Yeah,
Per-
school expulsions
per-
is a whole
per-
other area.
Per your
but-
report, but I
can
mean,
start.
that's where it starts, at kindergarten. I was shocked.
Mhm. So where we get kids assessed and how we get kids assessed for mental health will be part of the work of this behavioral health committee. How do we sort of separate, right, that from the justice system when it doesn't need to involve the justice system? Then we'll have another work group related to just the screening tools, procedures, and policies. And this is something that's already fairly strong within the Office of Court Services. I mean, they're providing guidance to counties on using the Indiana Youth Assessment System, but we'll look at that and see if it matches up with what the statute requires in terms of those policies and procedures. Maybe put together a sample policy that local counties can take and kind of tailor to what they need. And then there'll be a group just looking at sort of the grant program funding and infrastructure. So there's a few different grant programs sort of established by the bill, but of course they're not funded because last year wasn't a budget session. So if, and I believe Senator Kreider has mentioned that he's intending to go back and file legislation to fund this work in the next session. So what should that funding look like? How does it get out to the counties? There in the statute, there are some of the grants are intended to be formula grants where every county gets something, but that formula needs to be developed. So how do we take into account the different needs of the different counties and develop a formula that's fair? And then some of them are intended to be more competitive grants. So we'll have a work group to kind of work out all that kind of funding infrastructure, including ICJI, because they're ultimately the ones that are going to have to administer it. There will be a work group. This one is in italics because it's not really under the authority of the Children's Commission, it's under the Judicial Conference, but again, we'll be collaborating closely together. A work group looking at creating those juvenile probation standards. And then what I'd really like to do is also have a youth and family advisory group that can be consulted by all those other groups, right? And kind of have input into the work that's being done in the other groups. I've kind of gone back and forth on different ways to make sure that youth and family voice is present, and kind of having an advisory group that representatives from those other groups can come to seems logistically more feasible than having youth and family representatives on each of those work groups, which would be another way to do it. So that's the thought right now. And then I'm going to go over the timeline. So right now, we're at April 2022, and my hope is that by the end of this month, the Chief Justice will have made the appointments to the oversight body. So we've been talking through some different draft lists, we've got some ideas, but I think if any of you have specific thoughts about recommendations for the oversight body, please communicate that to the chief and me. And she'll be finalizing those appointments here by the end of the month.
Right, and I'll send them, I'd like to send the proposed ones out. There are people from all of your agencies
Mhm.
on it, and we probably, or Julie's talked to you, and this is like a spoiler alert, but I'm trying to talk Justice David, who's retiring this year, to chair this. This is such an important body. I know, well, this is why, if you see him, tell him what a good idea it would be for him. He's unbelievable leadership, and those, you maybe don't know, he's got, 20 years of juvenile justice experience. He was very involved with JDI. He, all his military experience, he can move programs and projects. So I had breakfast with him the other day, and I called Wendy, Representative McNamara, and she goes, I don't want to push you into this, but I want to push you into this. I think he's open. I think he's open with regard to you doing it as a senior judge. So just, there it is. You heard it here.
So we'll get those appointments made by the chief to the oversight body, and that oversight body, you actually, there is a document in your packet called 1359 implementation structure, something like that, that gives a little bit more detail of kind of, what these plans are. The oversight body should include, I think it will include in the final analysis, somebody who from each of those work groups, right? So there's coordination there. But we'll do the rest. Then the oversight body actually will appoint the work groups, but I've got lists of names going for that as well. So again, if you have suggestions, let me know. I'll put them on the list. I'm going to provide those names as suggestions to the oversight body and the chairs of the work groups. And then the rubber hits the road here, late May, early June. The oversight body by law has to convene by July 1st. So late May, early June, hopefully we'll have that group together for the first time, and then start the work groups in July, and then they'll be off and running. Most of those projects that I outlined are due next July, 2023, except the things that require funding, right? Because we're coming into a budget session. So the grant programs have to be designed really quickly this fall. And kind of what does that funding have to look like? The other one that's going to be a little bit challenging with the data plan, because I think that's going to take a while to flesh all that out. But one of the elements that has to be included in the data plan is, and what would it cost to actually implement this data plan? And so of course that information is also going to be needed heading into session. So that's what the timeline looks like. We'll have our regular commission meetings sort of in between there. So as needed, or as the oversight body kind of feels like one piece of that work is done, they will come and present it to you, or have their work group present it to you for feedback and kind of finalization. And we'll go from there. I think that's what I have on 1359. Any questions on that, the kind of the logistics or the implementation of that? It's going to be a lot, and it's going to be fast, but it's going to be great work.
We're also seeking funding for additional staffing. So we're all kind of working on trying to find that funding piece. Julie cannot cover all the staffing that would be required for this. So
Yeah,
we're
I
working
can't
on
even
that
send the
as
right
well.
PowerPoint, so I need some help.
That was her silent cry for help. All right, any other questions on the 1359? And I would say, I was a juvenile judge for many years. And even before I was juvenile judging, when I was a private practice attorney, I was either at CASA or Guardian London for hundreds of kids. And this is big, because this, along with looking at the mental health, this is going to help DCS with regard to getting the kids in the right placement, and just unifying, have some consistency, having evaluations. When I was a juvenile judge in the late 1990s, it was post-Columbine, let's get tough, we're gonna, if we get tough, the tougher we get, scared straight, it doesn't work. Things like I would send kids to Johnson County to meet with inmates, thinking that'll do it. No, that didn't. We made them worse. So when we start having risk assessments, where you can see putting low-risk kids with high-risk kids, we are going to make them worse. Just putting a child in detention from school. Schools used to call me all the time, for arrests. And finally I said, we're going to find some better way than arresting kids in school with regard to teen courts, peer mentoring, restorative justice. So there are a lot of things to work. We just need to do a better job on getting them out there and standardizing some practices. One county, there's Tippecanoe County maybe sent 10 to 15 kids to DOC a year. There'd be another county that would send 90 to 100 kids to DOC a year. What was the difference?
Mhm.
So I think this is a real watershed moment on getting this to roll out. And we'll need all of you on this. And I believe with Julie and I talking about this, I want to send those around to see if they have additional names. We've got some names that people from all your agencies on it. We want the youth voice. So anyway, we're really thrilled and I really appreciate the legislature. That was a heavy lift getting that legislation through. I wish they hadn't stripped the fiscal piece out, but other than that, it's an excellent piece of legislation. Excellent. Thank you.
Okay.
All right.
I love you, Dan.
It was.
All right. Any other questions on that? And then Julie, you have updates.
Yes, so the rest of this meeting, it's kind of nice, actually. We have a light agenda, and so I'm gonna talk to you, and then Janie, the intern that's been working with me this year, is gonna talk through. We want to talk a little bit about what have we accomplished as a commission, and then what follow-up is still needed? Are we, once recommendations pass, what happens? Do they get implemented? So she and I have been doing a lot of work together this year on that topic. This is also 2022 is year 3 of our current 3-year strategic plan. So by the end of this year, we will need to have a new strategic plan. So that's kind of something to think about. I don't have any even a proposed process for you today, but we'll be thinking about how do we want to develop that next strategic plan. But I thought this would be a good time to just check in on the current one and go through the objectives. And I did this for you, must have been 3 years ago when we were getting towards the end of our last strategic plan. And there is, again, in the handouts, I think you should have it, and it's online, more of like a colorful Excel with some green and blue on it. Yeah. And that's our tracker. I think the task force co-chairs, when they hear that word tracker, they get chills because nobody really loves filling it out. But it's helpful to see what kind of progress we're making on the objectives that were included in the last strategic plan. So I'm just going to do a quick overview. So our child health and safety is our first task force. We have an objective around wellness in the first year of life with the intent of, kind of dovetailing that effort with everything that the health department and FSSA are doing around infant mortality. We wanted to kind of focus more on that community side of things. How do we kind of surround those young families with the resources that they need? So there's work going on in that. There's a subcommittee that is looking, and I believe they're looking specifically around transportation and what are the barriers to accessing some of the community-based resources. So they should be coming to you with some recommendations sometime before the end of this year. Child abuse prevention, you've heard a lot about. We had the launch of the framework and the toolkit at the last meeting. So I'm calling that complete. They did an awesome job from recommendation to really fulfilling that. And then it's complete / ongoing because we completed the framework. The ongoing part is now, how do we get that out to counties? How do we encourage counties to use it, to implement it? How do we find resources for counties to use it and implement it? So all that work is still going on, really led by Terry's prevention team at DCS, but with lots of different stakeholders. Safety of children in state care, that group did quite a bit actually under the last strategic plan. We kept the objective in the current one, but it actually didn't quite take hold this time around. So that one's not really moving. We added an objective in the current strategic plan on reducing sexual victimization of adolescents because in the last round of youth risk behavior survey data that we had, our numbers were frankly horrible. And so we thought, well, what can we do to help on that? We've had a tough time getting traction with just having the right people in the subcommittee and leadership. We've had a lot of turnover, but we have 2 leaders now that are really working on that. They've got their subcommittee together, I think, this month. And they're gonna look at some recommendations around that
Plus they're
issue.
doing regional trainings with regard to child trafficking on that.
Yeah, well, that's a separate objective. That one's with the CSEC group.
Okay.
Yeah. So this is kind of like every kind of sexual victimization that's not trafficking. It's like all the rest of the picture. So we'll see what they come up with. We have an objective around kinship families. That was Representative Summers' suggestion. You'll recall this was probably a year or two ago. They brought the work around getting guardianship forms onto indianalegalhelp.com. So when there's uncontested kind of kinship arrangements, they can get guardianship of those kids. They're still going. They're looking again at maybe some recommendations related to childcare and education. So if grandma's caring for the kids, how can we make sure that, you know, that she can do what needs to be done at school, or that she can get access to childcare? And then there's two more under child health and safety: decreasing the uninsured rate and then increasing developmental screening. And those are both also in progress. You all approved a recommendation last summer related to getting kids onto CHIP without a waiting period. And that group is still looking at some additional tweaks, maybe policy things that could be done to continue to further just get more kids covered. And then we have a group that's looking at how do we get more young children screened for developmental delays, because of course, the earlier you catch them and intervene, the better off those kids will be eventually. Then we have our mental health and substance abuse task force. You also have heard from them recently in evidence-based practices. So we have that MST pilot project that's getting off the ground. That's really, really exciting. That came straight out of that subcommittee and then happened to dovetail with a federal funding opportunity. So that's getting moving. We have a group that's really looking at the mental health workforce, kind of provider pipeline and retention. They have brought you some recommendations related to licensing, which you passed and which were passed into law. They're looking at other things now. So what else besides licensing? How do we make sure we have enough providers, keep the ones we have, attract more? We have a group that's looking at parity of mental health with medical, and they've been working really closely with the Department of Insurance and trying to get data around that and come up with some recommendations. We have a group that is, we call it innovations and service delivery, but they're really focused on that mobile crisis response. You heard from them several times over the last few years. Really looking at the data, at how many kids end up in the emergency room where maybe a mobile response would be more appropriate. And I know that work is all being built into the 988 planning. So that's, you know, one of the things that seems to be happening, and it's really cool, is we get the people together who are studying the problem and they start to see a solution. They don't know how that solution is going to get implemented or like, where's the funding going to come from, but they do the thinking and the research. And then the funding shows up and then we're ready. You know, we have the idea and the program and the research ready to go. So that will come into the 988 implementation. It might also come into the behavioral health plan that's required for 1359, right? Mobile response, I think, will be part of that continuum as well to prevent kids from, you know, there's the ER and there's the police, right? And those are kind of the options sometimes that families have. If we have mobile response, then that's a better option for some folks. We've had a little trouble getting our prevention group going. We need to get back in touch with the person who's leading that work. You've heard several times from our suicide prevention folks, many different sets of recommendations on that have come through here. Educational outcomes.
Julie?
Oh, yeah.
Sorry, can you explain the 988?
Yeah, so we had Chris Drapeau, I think last October, gave a pretty thorough explanation. So 988 is the new suicide prevention hotline, right? Instead of that long 1-800 number, it's going to be 988. It goes into effect. Jay, maybe I should have you explain it. Yeah.
Yeah, well, you're getting it right. So 988 is a new 3-digit number for suicide prevention, but it's also an opportunity for so much more. So building an entirely new system of crisis response, including someone to call, but also someone to respond. So these are the mobile crisis teams and somewhere to go. And so it's a long process. I think just as Rush mentioned, 5 to 10 years is probably what we're looking at, but I think we're in a good place now to start building that in. So.
And the number goes into effect July 1, right?
Yes, the number goes in. It's either July 1st or July 16th, depending on who you listen to. So there's some federally driven confusion on that one.
Okay. And there's a big legislative piece to that too. I mean, just like you remember the day there wasn't 911, right? So you'd have to find out the number if you had a crisis and call. We're looking at building 988 into 911. There'd be lots of legislation involved. And there is a surcharge that can be on the cell phone, just like 911, they can start building that. Where do you put somebody? Do you have a crisis intervention team in your community? Do you have a crisis place to place them? So it's going to be a long process, but you'll hear a lot about, because you're going to get a lot of legislation with regard to implementing it. And I like to think it's not just suicide. I like to think it is crisis.
Absolutely.
Mhm. Educational outcomes has these 5 objectives that they're working on. They're all kind of in progress. We added into this current strategic plan early care and education, which was not previously. And we know that we have the Early Learning Advisory Committee, and we don't want to duplicate anything that's happening there, but we want to sort of be a voice for those vulnerable children, right, that we're statutorily kind of responsible for thinking about, right? Kids served by DCS, by FSSA, by the justice system. And so what that task force decided to do was basically just kind of liaison with ELAC and with FSSA and make sure that we're in touch with the early childhood efforts and that we're kind of beating the drum for the most vulnerable young children having high quality early learning and care. We have the positive discipline group that's working on recommendations. That goes back to your point, Senator Bro, around suspension. I mean, how do we reduce suspensions and expulsions, especially of very young children? There was one interesting data point in the Kids Count data book was that, do you all know which in the K-12 spectrum, which grade has the highest number of suspensions? Does anybody want to guess?
6th.
8th grade. 8th grade is when you're most likely to be suspended. So what are we doing with those middle school kids? Can we come up with some better recommendations for how to keep them, calm them down, keep them in school and not disrupting the education of others? We've been looking at the issue of school record transitions. There's been a lot of data transformation going on really across the state, including within DOE. So that one kind of was on hold while DOE rolled out its, I forget what it's called, but they have kind of a new data system. So we'll look at that again. And then we have a group that I think you'll probably be hearing from sometime in the next couple of meetings regarding post-secondary education and workforce options for, again, our vulnerable youth. So if we're thinking about our justice involved, our DCS involved kids, our kids who may have mental health issues or just poverty, how are we preparing them for post-secondary education in the workforce, and what can we do better to kind of strengthen their pipeline to success? So they're going to have some recommendations soon. And then the last one is juvenile justice and cross-system youth, which you've heard from in the last couple of meetings. We have a group looking at dual status. You heard from Judge Malo last December. They updated their training manual. They provided a training. They're doing some ongoing data collection to see, just like everything, right, with justice, it can look different in every county. So but they've done a number of things kind of on the back end regarding that data collection so that we can get a better picture of how often counties are using the dual status process and what the outcomes are. This is where the CSEC group shows up. The commercially sexually exploited children have also updated their manual for their trafficking screening tool, and they've got that created technologically as well with Insight with the courts. And the plan is to roll that out this summer so that all juvenile probation departments will also be screening kids for trafficking and making appropriate referrals. You heard from the shelter care subcommittee last summer related to, how do we get kids into shelter care who need it? How do we not use shelter care for kids who don't need it, but get them in families? And so there were a number of recommendations that were presented to you on that topic. Diversion, you just heard from. We have a group that's looking at serious and violent delinquency, right? So the other end of the continuum, because the kids that are low risk, we want to divert out. The kids that are committing serious acts, we want to know what's the best way to deal with them. And second, of course, we want to know how do we prevent that from happening in the first place. So we have a subcommittee that's looking at that, and is also, I think they're tentatively on the agenda for June to present some recommendations around evidence-based violence prevention. We had a group looking at family engagement. What's the best way to engage families within the juvenile justice system? They presented to you also last October. The transition group you heard from last time. And then we have just kind of a broad umbrella of how do we take child and adolescent development into account all throughout the juvenile justice system. So those are our 4 task forces, our 4 areas of the strategic plan. As you know, we also have some committees that don't have specific goals in the strategic plan. They're more there to kind of inform everything. And so, but they've also done quite a bit in the last couple of years. So I just wanted to highlight that for you as well. The Equity, Inclusion, and Cultural Competence Committee, presented you with a common language document a couple of years ago. So that's a resource that's out there. They put together that list of kind of vetted trainings and educational resources. So when folks want to start training their staff or training themselves, they have a place to start. The 7-question equity guide for looking at policy and how it impacts different groups. And then they put together this kind of staffing guide. So if you're hiring a chief diversity or chief equity officer, here's some things to consider. So they did all of that basically between 2019 and 2021. And now we're gonna try something new here. We just decided to do this to sort of detail members of that equity committee to the other task forces, to just kind of be a voice in each task force to make sure that we're always thinking about, well, is what you're saying true for all the groups of kids, right? Or have you looked at the data disaggregated, and how do we make sure we're coming up with solutions that are have a universal goal, but maybe targeted solutions?
You know, I was just thinking about that earlier in the presentation. And then I said, well, no, it doesn't really apply, but we really should have the chief equity officer, and we do have a chief equity officer here at the state. Should that person be included on this commission?
So
and
I've
added
met
statutorily?
Oh, on the commission? I don't know. It's an interesting question. I've certainly have connected with her and folks in her office, and her person she has someone who's in charge of sort of equity data within that office. And they're going to be part of, I think, hopefully part of the data work group with the juvenile justice. So we've got that one specific connection. In terms of sitting on the commission, I'm a more the merrier kind of person, but I don't know if everybody feels that way. But yeah, it's an issue that flows through everything.
Well, you know, we do have a chief equity officer for the state, and I think
Yeah.
that we ought to use that person in as many circumstances as we can.
Yeah, and this committee has representatives from those kind of corollary offices within many of the different state agencies, right? So FSSA has the Office of Healthy Opportunities. We're developing that infrastructure, I think, across the state agencies, including the Supreme Court. So as soon as those people get hired, we try to pull them in to the equity committee. Yeah.
Good.
Mhm. We also have the Child Trauma and Resilience Committee, which you've heard from a few times. You adopted statewide definitions for trauma, so everybody's on the same page. If we're talking about trauma, we're using the same definitions. You adopted their recommended position statement on the use of ACEs and those kind of adverse childhood questions. When should and should not we be asking those questions? What should we be thinking about if we're asking them? And then an additional guide for doing some of that trauma screening and assessment work, and kind of some considerations around that. Data sharing and mapping, of course, produced the update on the information sharing guide. That was a huge project that launched in October 2021. And then you've heard a few times about the Vulnerable Youth Dashboard. I think that's in progress over at MPH. And then, of course, as I mentioned, they're going to be closely involved with the 1359 implementation, the data portion of that. And then the other two committees, of course, the Communications Committee really is more of kind of an ongoing resource and consultation group for me when there's communications issues. And then the Child Services Oversight Committee, which is sort of a thing of a different kind that was brought under the commission's umbrella, and they've kind of met their statutory requirements and looked at a number of different topics when they met last fall. So that is where we're at in terms of, kind of the last 2.5 years since we adopted our current strategic plan. Any questions on that?
I'm exhausted.
Yeah, and the reason all of that could happen is that there are over 300 people involved with this commission. You don't see them all around this table, but we have, all those task forces and committees also have subcommittees. And so there's all these people really volunteering their time to dive into these issues and really try to come up with the best solutions for our children. So it's a lot of commitment from our volunteers, and particularly our task force and committee co-chairs, which is why, as Chief Justice said, we allow them to step off every 4 years and kind of rotate that leadership role, because it's a lot.
Anything else for Julie on that? I asked her to do that, just to give an overview, and we are talking in the executive committee, which any of you are always invited to come to, with regard to how we measure the outcomes. So we've come to, there's items we vote on each. This is one of the few times we didn't vote on anything, but we look at recommendations, we adopt them, And we want that next, okay, to what end? And then we're looking at measuring and be able to come back so you can see what impact it had and where it went. There can be a lot of good ideas. We can vote on things. We don't want them going off into the stratosphere. We want to make sure that they're being done.
Exactly. And that's exactly what Janie's going to address here in a minute.
When we set these.
Use the
strategic-
mic.
When we do these strategic plans and we go about planning, how do we check the data to make sure, like, say, if we have plans that have taken a couple of years, what data or like how would we as members go and check up on the progress of our goals that we have collectively?
So that's what I just did. But that's pretty much, it's actually one of the things that we need to work on developing. And again, you're going to hear from Janie with some recommendations around that, I think, because we need some better processes for documenting those kind of how we're doing. But everything that you just saw really is still just process, right? But you're talking about outcomes, right? Like how do
say
we
for
know?
instance, if we weren't here, say if I wanted to be like, hey, I know we started this like this and in the commission this date, I want to see where we are with that. Would
Yeah,
we be able
as
to-
of right now, today, you just call me and I tell you. But we need to have some better systems in place, right? So it doesn't depend on one person kind of remembering. And that's kind of how it is now. And Janie has helped me formalize some things and get some things down and like out of my brain and onto paper. So that'll be there, but we need to keep doing that.
All right, nothing else? You want to introduce Jamie?
Oh, yeah. And I just wanted to just quickly point out, we don't have to go over all of this, but my final legislative bill list is in your packet as well. I did my best to summarize the summaries so they're in more plain English. And just so that all the different legislation, I sorted it by topic. I was going to kind of highlight these specific ones that I thought people might not have necessarily paid attention to if they weren't in your specific area. But you can read the summaries there. And I'll hand it over to Janie. And let me just say before I do that, so Janie Smith is going to graduate with her MSW in about 3 weeks. I think 3 weeks. So she's yeah, huge accomplishment. So she's been working with me this whole school year about 20 to 29 hours a week, really on exactly these questions. So she's going to talk to you about kind of what she's learned and what she's helped me learn and some suggestions for moving forward. But she's been really, really amazing. And maybe when you finish your presentation, you can tell them about where you're going next. Because that kind of came out of the commission work as well. Okay, so I'm gonna hand it over to Jamie.
Hello, everyone. So like Julie said, my name is Janie, and I'm getting my master's degree right now at the University of Indianapolis. And I've been doing social work for pretty much 10 years, and all my work has been in child welfare, communities, and families. And so when I first met Julie, one of the things that we talked about was how I spend my time, what will I do? And since the commission was already talking about doing a program evaluation, Julie thought it would be good for me to see, to explore how are we implementing things. And so I kind of started this process with talking to my professor about what I had to do. And she said, well, what's the name of your practicum? And I said, the Commission on Improving the Status of Children. And she goes, well, that's where you start. How are you improving the status of children? She goes, like, you need to see like facts, like how are you doing it? How have you done it? So that's kind of the question that drove me through this process of looking at what Dejana talked about, recommendations. Where do they begin? Where do they end? And is it important to go back, or is it only important to talk about them and make recommendations? And so some of the things that I did in all of my reading, I pulled out some interesting facts, is that there have been 50 members since inception. So although the positions of the commission have stayed the same, people have rotated in and out. Chief Justice is the only member that's been here since inception. And the
And I think
second,
I'm the oldest member too.
I did not tally those numbers, but the second longest member was Susan Lightfoot, who left in 2021. And then after her, the second longest standing member is Christine, who's not here today. So since 2013, the commission has been designated with 59 direct tasks, recommendations, and endorsements. So these are concrete things that we were asked to do, to endorse, that we said yes to recommendations to. And then there have been 41 recommendations specifically that were voted upon. So I didn't tally recommendations that were tabled, or I tallied those, but not for the purpose of this presentation. So this presentation will go over things that were voted yes to exclusively. And so what I did to come up with implementation and how we're looking at things, I looked at annual reports, strategic plan. I really looked at the minutes. I read all of them that have existed. And so really just to see what's been happening. And then as the chief mentioned, where did it go? Somebody said, yes, I want to do this and I'm going to do it. Well, did they? I don't know. And Julie didn't know, and nobody knows if they did it or not. And I looked at what was voted upon. I looked at other commissions around the US. So how are they holding others accountable? So some places that I looked at was Connecticut, Arkansas, Florida, Hawaii. They all have commissions that do similar work, just in a different way. I think the one that I found the most intriguing was the one in Arkansas. Since the Walmart headquarters are there, they have people from Walmart on their commission. And I thought that was really, really random, but they do. And then I also did a lot of reading on scholar articles about policy dealing with children and how do you move things forward. I would say a summary of those articles says that's a difficult task because people change and policy is driven by people. And so it's really a long game. And then a lot of my information came from Julie. Like she said, since she's been the only staff member, she holds a lot of information in her brain. But what I told her is one day when you're not here and you go on, somebody else has to know where to pick up. And if you're holding it all, they won't know. So I wanted to figure out a way that she could put things down so that the next person that comes after her can just kind of pick up and not be squandering around trying to figure out where to start. And so where I see us now is that in 2013, this initiative came. In 2016, they had the first strategic plan and operational plan. In 2017, Julie's position was established as the executive director. And then now in 2022, almost 10 years later, the commission should be seeing its efforts in communities and state agencies because it's been happening for 10 years, which is a pretty substantial time in policy. And so one of the things that I studied and looked at was implementation science. So there's a lot of reading about implementation science and how you're supposed to do it. And so where I see the commission at right now is straggling in between installation and initial implementation. So it seems from my point of view and looking at all the things that I've read is that we are straddling in between those two spaces. And we really need to get to full implementation. So we really need to see recommendations come to life and then be able to go to an entity and then see what we did here is actually happening. And then be able to pull data from it, like the ladies talked about earlier, because if you don't have data on it, it really doesn't exist, truly. And so that is kind of where I see things. And we've had longer than 2 to 4 years, which in implementation science, that's what they would say is about how long it takes to get something off the ground. And this would only be for one task. The commission has a lot. So you could take this time frame and apply it to the different things. And so one of the next steps that I would definitely recommend is implementation tracking. So in your packet, you have a snapshot of a chart that I created, and it breaks down recommendations. Now, what you see here is what Julie was able to complete. And so this starts at 2019, but I did go all the way back to 2017, which is where the first recommendation came forth. And so it has on here year, type of action, description, who submitted it, who's going to implement it, who said they were going to implement it, what steps were taken, recommended additional steps, proposed date, desired final outcome. So I put desired final outcome and not final outcome because sometimes we can only get what we can. And so it's not always that it will happen.
It's this 2-page, both sides. It's this.
Yes,
one,
yes.
packet.
And then,
It doesn't have a title, it just starts with like your type of action.
no, yep, and I call it a CIS task tracker because they're tasks. And is there a legislative process needed? So is there additional steps that go beyond this group to get it done? As you can see, some things you are clearly able to fill in and go across. And then there's other sections in here that kind of lead into the next step of accountability where they have question marks, where there's nothing documented to show where this went. And so one of the things that I talked with Julie about is how can we all work together to make sure that things are happening, or at least start the conversation in your agency and say, hey, did you do this? Or can you tell me what happened? And then be able to come back and provide the commission with a formal or informal update, so that if you ever wanted to produce something like next year, the commission will be in place for 10 years and say, this is what we've done in the past 10 years. And then you can say who did it, how, and what our position was. But if we have a lot of questions on things that we recommended, we studied, we said, this is great, then you can't really do that. You can't really say that you did anything besides make a vote. And so the next thing would be documentation. So there does need to be a formal process of documenting our efforts. In addition to that, there has to be support staff. Prior to Julie ever being asked about additional staff, I had told her, I don't think it's possible for you to do this process because it took me, August till June. And that's just one part of the job. And so you would need somebody to continue this, or it would have to be a group effort. And with everybody else's responsibilities, I don't know if a group effort is the best way to do it, if an individual could just kind of take this on as a part of their role. And maybe out of the program evaluation that is being done right now, they will kind of create a process for that. Maybe for Julie, that's a little bit more simple. But there does need to be someone to take this on so that you do have kind of the history of what you've accomplished. The next thing is an ongoing process evaluation. And so one of the things that me and Julie talked about were, if you're going to vote on a recommendation, do you want that part of the commission to stop there? Or would you want during that meeting to tell that person, come back in 6 months and tell us what happened? Come back next year and tell us, where did this go? So you have to create something to check your process to see, is it working? Is meeting every other month enough? Do we need to have side meetings to make sure things are happening? Should people be submitting things? And should some things be voluntary of volunteers to do, or should some things kind of be a requirement to say, hey, if you're going to volunteer on the commission, this is really necessary for you to do it. I think right now the volunteers are kind of here, they do their work, they can leave. Sometimes we ask things of them, sometimes we don't, but oftentimes they leave and we actually need certain information and we don't have it because we didn't ask. And so maybe just setting up a certain level of expectation if you're a volunteer to get feedback on what you're working on, going out to the community. And most of the volunteers they do direct service. So it should be, and like I told Julie, even if they could ask one person in their agency, hey, did this help you? Yes or no? That's good enough. It doesn't have to be some statewide thing, agency-wide survey, just some form of feedback to know that meeting every other month for 2 hours is worth it. And the last thing is just continuous quality improvement. So just consistently setting up a way to evaluate to make sure that the commission is effective. Like I told Julie, when you look at legislation and what it outlines for the commission to do, you are all doing an excellent job at your legislative duty. But the implementation piece is not required. So then that's kind of left up to you. Do you want to implement? You don't have to. In other states, implementation is written into legislation, and it says that the commission has to implement these things. So the wording is different. The legislation for ours doesn't say that, except I think for maybe one task, if I remember, but implementation isn't used in that language. And so it's really up to you. How far do you want these things to go? I think that it's worth it to see it to the end because it's your time. And like I told Julie, if other people have come, they've made recommendations, it's all great ideas. And then going back to the first question of why we're all here, which is to improve the status of children, then we should be seeing things through because that's what these things are going to do. And that is it. That's what I've created. And I created some additional documents that I'm going to leave behind with Julie for her to kind of keep up. But I do want to leave and encourage you all to hold each other accountable. And when people are coming in front of you, making recommendations and you're saying yes, to hold them accountable to making it happen, because that's really the purpose. So,
All right, so your next steps, you're supposed to tell us.
oh yes, in my next steps, I will be working at IU under their Strengthening Families as their operation manager. So working in communities. So, yeah. The Family Resource Centers, yes.
Thank you. Any questions?
You did a really good job.
I hope you got an
Thank
A.
you.
Did you get an A?
I will find out at the next week. Yes, next week. Yes.
I just wanted to say, sometimes the holding accountable is directly connected to the funding that is available, which is
Yeah.
sometimes problematic.
Yeah, I would agree. And I think I told Julie that if you're going to be looking on bringing people back to talk about recommendations, if they can do it, yes or not, then you could say they don't have to, or you could say it's a funding thing. So then it kind of, that's the issue. So you can move on instead of kind of wondering like, did that ever happen when it concretely didn't happen because of funding? Yeah.
It makes me wonder if the accountability piece will help with the funding so that we can like zero down, you know, exactly what we need funding with and what we don't no longer need funding with. What process took care of what this problem and that problem, you know, makes me wonder.
That's true.
There's an intangible too, because there's ideas that have come out of these meetings, these recommendations that we've taken back and made changes in the judiciary. We've changed the policy procedure. We've added this as training. And that's some of it's harder to mark, you know, in working with FSSA, Jen before, and looking at substance abuse, we did regional work where every county had to do a sequential SIM and some of the opioid money. So it's hard. I mean, there's recommendations and then there's information sharing. Because back in 2013, the different branches of government, we had like 30 different committees or commissions that dealt with these issues. There'd be some legislation. This was the issue du jour. Let's have a committee to study adoption practices. They have recommendations and where does it land? So there's what happens when we vote and take action where we can look at the implementation. And then there's the intangibles with regard to Representative Devon having something and coming, or I'm talking to John, I've had 4 recommendations that have gone on just since I've been whispering to him during this meeting. I've sent a text to Justin, say, why are we not collecting this information, making this mandatory? So there are those two, but I think definitely we can track the implementation that can happen on the actions when we vote on, when we say that we vote to recommend that the administrative rule change with licensing requirements being so we can get more therapists and social workers out there. We could definitely judge that if we had somebody that could go and pull up the numbers, what has happened as a result of that legislation.
Yeah, and some of the things they were really small, something as small as we want to show this film this summer. We think everybody voted yes. Did it happen? Did the film get shown? So some things are really easy, like you said, to find out, and other things are a lot more difficult and they have multiple steps. But that doesn't mean that people can't come back and tell you the result, just so that you know what's happening.
I like that, yeah. Any other questions for Janie?
Sorry. I have a real quick question on your graph. Who determined that legislation process was needed? Was that you or?
I filled those in.
Okay.
Julie filled it in.
Yeah,
yes.
and most of them, it was like, was there legislation or not? Because we were kind of already past it, right? But if it led to legislation, I think I said yes.
Okay.
So was there a particular one that you
No, I
were
was just
wondering about?
asking the question,
Yeah.
how it came into play.
Yeah, all of those. So Janie created the list of what all you all had voted on, and then I took out of my brain and memory and filled in like, what am I aware of that happens? And then you can see where the question marks are where I don't know, and that we need probably some follow-up. And in the recommended next steps, most of them have like, we need to follow up with this person or that agency and really find out.
Any other questions?
I just wanted to say, to your point, Chief, about the informal things that come out of the commission. One way that I think I'm hoping we'll be able to capture some of that is in our work this year with Transform on the evaluation project. I think they're going to be interviewing all of you and asking you those questions. So like what has it meant to you and to your decision-making and thought process sitting on the commission? So those should be coming sometime in the next couple of months.
All right, thank you.
All right, thank you,
For all
guys.
this past year.
Yeah.
Right. Julie, anything else? No. All right. We are adjourned. The next meeting, June 22nd. All right. Thank
Chief
you all.
Justice.
All right, Julie.
Chief Justice.
Chief, can I make a quick invite
Yes.
before everybody leaves? Those of you in this room may have gotten an invite from IPDC yesterday, but I want to invite everyone and everyone who can hear my voice to join us for a one-day juvenile competency assessment and attainment program that